and colleagues, members of the Bureau of the Committee for the Exercise of the Inalienable Rights of the Palestinian People. Good morning to our distinguished panelists and to our guests and friends around the world. My name is Sheikh Niang, and I am the permanent representative of Senegal to the United Nations, and I am chair of the committee. I am joined by colleagues and members of the Bureau of the Committee. Today, we are talking to three representatives from civil society based in the occupied Palestinian territory, precisely from three locations, from the West Bank, from East Jerusalem, and from the Gaza Strip. They will address the following topic, I quote, the COVID-19 pandemic under occupation, national resilience, and international support, end quote. So we have with us today Mr. Ali Ghaith, a Palestinian journalist and activist from East Jerusalem. May I ask first Mr. Ghaith to tell us and tell our viewers about the situation in East Jerusalem during the current situation. How are you and how are your neighbors and the Palestinian community dealing with the situation right now? I can give you something like 6 minutes, Mr. Ghaith, to respond.
Thank you, Mr. Chairperson, for the opportunity to speak today. I send you good wishes of health and wellness to all the nations of the world. Before answering the question, I will be laying some grounds for my statement. So Israel has been practicing suppressive policies in East Jerusalem for the past 53 years, including land confiscations, settlement building, restrictions on construction, house demolitions, restrictions of freedom of movement, withdrawal of residency identities, and isolating Jerusalem from the West Bank by erecting the separation wall. With Israel controlling and using 87% of the land east of the city, 215,000 settlers are living in East Jerusalem. Its goal is to control the most significant size possible of the Palestinian territories, displacing Palestinians and reducing the Palestinian population in the city. So, after the establishment of the separation wall, these policies have intensified, and communities outside the wall were formed that are not subject to the Palestinian rule, but are subordinate to the Jerusalem municipality, thus pay taxes similar to those living in West Jerusalem. As for those communities outside the wall, they are distributed as follows. We have at the northern area, we have Kafr Aqab, Semiramis, Al-Sharayat, and the airport region, Al-Matar. To the east, we have Ras Khamis, Al-Salam suburb, and Shafat refugee camp. And to the south, we have Sheikh Saad, Al-Walaji, and part of Al-Sawahri and Abu Dis. The number of Palestinian population in these communities is approximately 150,000, and their percentage constitutes 16.5% of the total population of Jerusalem. The total amount spent by the municipality of the occupation to develop these communities and neighborhoods in the east of the city does not exceed 9% of the municipal budget. So there is a flagrant distinction in the disbursement process that results in the neglection of the provision of these social services that include health, education, and infrastructure. Speaking of the communities mentioned, they suffer from high population density. They are indolent in health follow-up measures, despite the presence of some representatives of the Israeli health centers. And with the emergence of a global pandemic such as COVID-19, it will adversely affect these communities and threaten their standing. We can define the commitments that Israel as an occupying power needs to concern itself with are the preventative measures, awareness campaigns, random and arranged examinations, emergency medical services, economic support for families affected under the principle of social solidarity, and securing a decent life. As the saying goes, information is power. However, there wasn't enough information dispensed by the Israeli Ministry of Health regarding the situation of Palestinians in East Jerusalem, especially those communities behind the wall. The information on the numbers of infected people announced by the Palestinian Ministry of Health is gathered through the infected themselves. And when and if they decide to take the news to social media platforms. Such cases would be a patient from Silwan who published a video announcing his infection and implored people to get tested, and another was from Ras Al Amoud, who announced the news of the contamination of 2 people through a mosque's speakerphone. The Palestinian Authority is also trying to gather more information, but its activity is impeded by the Israeli Authority, and Palestinian leaders are being arrested day in and day out. Also, the Palestinian Ministry of Health doesn't have jurisdiction in East Jerusalem, therefore the information dispensed is not 100% accurate. By Israel not dispensing accurate information regarding the infected Palestinians in East Jerusalem, it would be weakening the people's position in combating this pandemic, and it would blatantly and explicitly violate its obligation under international law. Up until today, there are 132 coronavirus cases in East Jerusalem and 123 in Jerusalem's Palestinian suburbs, as announced by the Palestinian Minister of Health in her brief this morning. Unconfirmed sources estimate that there are a dozen more cases in East Jerusalem neighborhoods that haven't been reported yet. At the onset of the pandemic, Israel entities, especially the Ministry of Health, didn't take any strict measurements to thwart the spread of the virus in the Palestinian neighborhoods of East Jerusalem. And it included, there wasn't any sufficient awareness in Arabic for the residents. There weren't any examination centers for Palestinians living behind the separation wall. There was an examination complex in West Jerusalem, however, near Malha, the Teddy Stadium. But under the restriction of travel, Palestinians in East Jerusalem neighborhoods couldn't arrive to get tested. There were no random examinations, such as those carried out at Jewish neighborhoods in West Jerusalem, most notably in Bnei Brak. In Silwan, the Israeli police raided a Palestinian medical center set up by the emergency committee, allegedly in violation of the law. The Israeli authorities shut down initiatives done by civil society organizations in East Jerusalem or the Palestinian youth, and their organizers were fined or investigated. These initiatives include providing food to affected households and the disinfection and sterilization of the streets in the old city. So, and additionally, the Israeli police continues to repress Palestinians and issues fines left, right, and center, all under the pretext of applying national instructions to combat the spread of the virus. Meanwhile, the Israeli Ministry of Health, the procedures, including examinations or awareness campaigns in Arabic, were completely absent from the Palestinian neighborhoods in East Jerusalem. The situation is bleak in these overcrowded, high-risk neighborhoods, especially behind the wall, and the Arabic awareness campaign that were released only recently couldn't provide solace or direction at a time where the only information source for Palestinian Jerusalemites were social media platforms and hearsay, exacerbating the problem and providing a fertile environment for misinformation and rumor spreading. Finally, Palestinians could easily decipher that Israel is only interested in stopping the migration of the disease from Arab to Jewish neighborhoods rather than attain to the rightful needs of Palestinians under the occupying power. I believe that this pandemic is as hurtful as it is to humanity. It sheds another light on the Palestinian pandemic, the Israeli occupation. It would be a tangible reminder, if all previous ones were not noticed, that Palestinians are living under occupation that should have ended a long time ago. These gruesome health repercussions have surfaced now, and unfortunately, I think they will continue to do so until the international community takes a firm stand against Israel and fulfill their obligation towards the Palestinians, not just in financial aid, but in assistance towards saving humanity in this part of the world and end occupation. Thank you.